Good afternoon. Welcome back to our Budget Conference Committee. I'd like to start with Mr. Newton from LAO. We are working now on the health portion of the agenda, Health and Human Services. We're starting with issue number 1, which is public health legislative augmentations. And Mr. Newton.
Oh, okay. Good evening, Chair Ting and Chair Leno. I'm prepared to give just a brief overview of the HHS area as a whole, the differences in conference, and my colleague who will be handling public health will be here just momentarily. Would it please the committee for me just to give an overview of the items?
Thank you.
Yeah, very good. And so I'm Mark Newton. I'm the Deputy over Health and Human Services at the LAO. We have a 3-page summary of the differences between the two houses in the HHS agenda that's before you on pages 3 to 5, and I'll be following that. I will now like to briefly provide you with some highlights of the differences between the houses, as well as some high-level observations and comments on the differences between the houses. Just on a technical note, when you're looking at the figure, it's 2 pages that summarize the fiscal differences between the houses, and 1 page that summarizes the language differences. In the 2-page table on the fiscal differences, for the most part, the differences reflect general fund spending, but there are a few cases that reflect non-general fund sources, and those are noted in the agenda. It's mainly in the mental health area as well as the public health area that have a few special fund related items. I also note that under mental health, the 3rd item down, which is entitled Mental Health Services Grant Program for Higher Education, that item has been taken off the agenda by the Assembly. The item relates to a policy bill, and apparently is the intent of the policy bill to provide funding beginning in 27-18. So it's not a budget year item. So that item has been taken off. So the first major thing to note when you look at all of these items is that almost all of the items, not entirely, but almost all, relate to legislative augmentations. And also, more specifically, legislative augmentations that are not related to a governor's budget proposal. But there are a few exceptions to this. I'll just highlight them for your information. Under mental health, there is actually a general fund savings item. The Senate adopted savings related to reduced workload from Proposition 47. It's about a $9 million general fund savings item. So that stands apart from the other items that are augmentations. Also, there is one major item that does relate to a governor's proposal, and it's found under homelessness assistance and poverty reduction, and it concerns changes to the governor's proposal to increase SSP grants. The governor had a budget proposal in January. The Assembly adopted the governor's proposal. The Senate offered an alternative to the governor's proposal. So when that item comes up in the agenda, we'll certainly try to clearly explain the differences between the two houses and the governor's proposal. So looking at the chart, it's a good illustration of relative priorities of the two houses. Looking at the 2 figures, one thing that comes to light is that mental health is a relatively high priority for both the Assembly and the Senate. There are some differences, though. And in terms of relative priorities, I would say that healthcare services is a somewhat higher relative priority for the Assembly. Homelessness and poverty reduction is a somewhat higher relative priority for the Senate. So just a few observations on the priorities that in a few cases where there are a few cases where both houses actually had the same priority for an augmentation, but simply chose a different funding level. And for example, under mental health, both houses approved an augmentation for what is called Continuum of Children's Crisis Services, but different funding levels. Under public health, both houses approved an augmentation to increase funding for sexually transmitted disease prevention, but again, a different funding level. In yet another case, sometimes the two houses had the same funding priority, but implemented it in a bit different way. And a key example of that relates to teen pregnancy prevention, where the houses differed in terms of which department would implement the proposal, as well as some somewhat differences in the use of funds. When we turn to page 5 of the agenda, you will see language-only differences between the houses, cuts across a number of policy areas within the Health and Human Services policy area. One thing just to note, particularly under developmental services, each house, both houses adopted a fair bit of language that would, in our view, increase legislative oversight of developmental services programs, and we would sort of recommend the collective adoption of both language, feeling that that would be a valuable action of the legislature. So just to conclude, Mr. Chair and members, just to note that while the LEO does not generally have recommendations on many of the individual augmentations proposals, because inherently those sort of are a matter of legislative priorities, we are certainly at FAST prepared to give you a fair bit of context and background information in the individual proposals. And when we do have a recommendation or a compromise to offer, we will let you know that we do. And at your direction, we'll be pleased to give you details on those. So we look forward to assisting the committee in your deliberations.
Thank you very much. Ms. Costa?
Thank you. Good evening, Mr. Chair and members. Amy Costa, Department of Finance. I'll start by providing just some high-level comments that will really be instructive on the administration's position throughout the Health and Human Services agenda. And as the analyst has noted, if there are specific items within any of the issues, we're happy to address those more fully. The administration opposes the legislative augmentations. Some of these legislative augmentations in the Health and Human Services area were funded by each House through the denial of the administration's local criminal justice facility construction proposal for $250 million. We continue to support our proposal to provide competitive grants to those counties that have previously received only a partial award or have received an award from the state for replacing or renovating county jails to improve custodial housing, reentry, rehabilitative programming, mental health services, or treatment space. Of particular concern to the administration are the areas in which this one-time funding has been utilized to fund what are really ongoing spending proposals. Additional spending commitments in the Health and Human Services area can create larger multi-year commitments, given increasing caseload and costs. In addition, having to later revisit these augmentations in a recession scenario is particularly difficult given the very sensitive nature of many of the programs, and can be difficult given federal law and court decisions. Our budget already reflects significant ongoing investments in this area, such as minimum wage, developmental services funding through the special session, implementation of the ACA, overtime for IHSS, and continuum of care reform implementation. Thank you.
Thank you. Any other comments or questions from the committee? Okay. Seeing none, we'll move on to issue 2. Mr. Newton or Ms. Worden?
Thank you, Mr. Chair. Meredith Worden with the LAO.
Oh, I'm sorry.
Issue 1 before you on
issue
page 6 of your agenda highlights a number of legislative proposals to augment the Department of Public Health's budget. The Department of Public Health has an overall budget of nearly $3 billion, of which about $134 million is general fund. Some of the actions are for what appear to be similar activities, augmenting existing program efforts, such as for sexually transmitted disease prevention and for the Adolescent Family Life Program, which serves expectant and parenting teens, where the level of funding provided and the duration of those funds differ between the houses. In addition, the Senate took actions to support implementation of the special session tobacco bills, provide funding for hepatitis prevention, additional funding for teen pregnancy prevention, as well as Alzheimer's early detection efforts. In contrast, the Assembly took additional actions to support the establishment of virtual dental homes pilot program and a violent death reporting system. Overall, the Senate approved about $134 million in augmentations, while the Assembly approved about $16 million of augmentations on this first issue, nearly all of which is general fund. And at the direction of the committee, we can provide you with additional information on these specific proposals and answer any questions you might have. Thank you.
Thank you. Ms. Costa.
Yes, there's one issue of note in this particular package that I'd like to highlight, which is the special session cigarette and tobacco laws funding. We do support the Senate version of this proposal. It really was a timing issue in which the legislation was signed during our preparation of the May revise, and so we do support the funding required to implement this legislation that's been enacted.
Wonderful. Thank you. Back to the committee. Senator Nielsen.
Mr. Chairman, I just want to acknowledge at this point in this particular section, I'm going to have some concerns related to redirection of jail construction monies. I think that's an obligation we owe the counties with realignment, and I'll be wanting to have that discussed at some length.
Absolutely. Thank you, Senator, for your comment. Any other comments or questions before we move on to issue 2? Seeing none, we'll move on to issue 2 then.
Thank you. Issue 2 on page 8 of your agenda also is for outlines 4 legislative augmentations that are related to public health but cut across a couple of different departments, including the Department of Public Health, the Emergency Medical Services Authority, and I believe the Health and Human Services Agency. Listed are these proposals on the Assembly side to provide an augmentation of $2 million to support ongoing efforts to operationalize the mobile field hospitals, provide for the establishment of an entrepreneurial training program for at-risk youth for one-time funds, and maintain the quality of care website through a special fund augmentation. On the Senate side, an augmentation of $150,000 general fund was provided ongoing to support a telephone line for the End of Life Act program.
Thank you. Ms. Costa.
Yes, again, within this package, we would just note that for the legislative augmentation for the mobile field hospitals, the administration is already taking active steps to redesign the mobile field hospital within existing resources. We have a plan to reach out to appropriate entities such as the Office of Emergency Services and the Military Department to modify and expand the potential uses of this equipment.
So just to touch on that, so you feel that the request is redundant, or that
we feel that we can use existing resources and work with OES and the military department to better utilize the mobile field hospitals versus providing an augmentation.
Thank you. Senator Leno.
Thank you, Mr. Chair. I have a question for the LAO, please. With regard to the Cal Quality Care website, are there good reasons for us to keep this private website independent of state operation?
We think that's a matter of legislative priority. The administration has expressed concerns with regard to that, given that it pulls from a variety of data sources, and so housing it, for example, on a state entity, there would be challenges in ensuring the veracity and reliability of the data that's being reported. It includes federal data, self-reported data across a variety of programs that provide long-term care services and support, such as nursing facilities, adult day health care centers, et cetera.
And is it accurate to suggest that the website has established its own criteria as opposed to basing upon state law? Nurse-patient ratios, for example, that would be among the criteria?
Some of it is pulling from state data based on state criteria, and others pulling from other sources. It would depend on which specific element I think you might be referring to.
But with regard to the benefit that it provides consumers, if they're establishing their own criteria, which is not necessarily even aligned with what we're putting into state law, is that sending some mixed messages, if not signals, to consumers?
The website is not governed by state law.
It is not?
Is not.
Right.
The website itself and the data collection itself is not governed by state law. It is pulling from some state data sources, which are collected via
So that's the basis of my question. Is
Yes.
that of concern?
I think in terms of establishing it at a state agency, there are concerns expressed by the administration and others to help ensure that the data is reflective of various state entities and control in terms of ensuring the quality of that information and how it's collected.
I know the ongoing cost of it is $500,000. Do you know what the original grant amount was?
I don't know off the top of my head, but I could get back to you on that.
Okay.
The original program was started in 2002, and I don't know what the level of funding was for that. It was supported by the California Healthcare Foundation, and it's housed at UCSF right now.
And this may have been touched on earlier, but I may have missed it. What sort of effort has gone into finding ongoing private funding?
I'm sorry, one more time?
What sort of effort has gone into identifying ongoing private funding?
My understanding of this proposal is that the California Healthcare Foundation will cease to support this effort as of August of this year. I do believe that there have been stakeholder efforts to try to find alternative sources, including licensing fees based on facilities that have data reported on this site. I am not sure as to the status of those discussions at this point.
Ms. Costa, do you have any idea?
Yes, to your previous point, Senator Leno, I would say that this website establishes its own rankings and recommendations on 7 areas of health facility care. So as the analyst noted, they are bringing down some data from the state level, but to the issue of rankings, those are really the rankings that this website has determined not necessarily aligned to either state or federal government. To your secondary questions, we don't have information on what plans there are to secure private funding for this, and we do have concerns about the appropriateness of this being housed by a state entity.
Thank you.
Thank you. Other questions from the committee? Comments? Okay, seeing none, we'll move on to issue 3, mental health legislative augmentations. Mr. Johnson.
Good afternoon, Mr. Chair, and to the committee. Ben Johnson from the Legislative Analyst's Office. And I'm going to give a brief overview of the mental health legislative augmentations and reductions on page 10 of your agenda. On the Assembly side, there's now actually $62 million in augmentations, a lower figure than what's in the agenda and in the figure at the beginning, because the mental health grants for higher education have actually been removed from budget bill language as a result of the policy bill enacting that policy bill on July 1st, 2017, rather than in the budget year. So what we do have is funding for children's mental health crisis services at $50 million. This is under the Alternatives to Jail proposal. And we have suicide hotlines at $4 million. This is state MHSA funds, mental health services funds, and this would support suicide hotlines statewide. And then finally, we have the Early Mental Health Initiative, which would provide $6 million in general fund ongoing to reestablish the program at the Department of Public Health to provide mild and moderate mental health services to kids at-risk schools. On the Senate side, there's about $95 million in augmentations, net of a small general fund decrease as a result of Proposition 47 savings in state hospitals down below. That would be an $8.9 million general fund reduction that was identified by the Department of Finance. Similar to the Assembly's proposal, there is an augmentation for children's mental health crisis services. This would be provided through $24 million, $6 million of which would come from a general fund reappropriation from SB 82, and $18 million of which would come from the Mental Health Services Act state administrative cap. The remainder would come from $80 million in general fund, which is also under the rubric of the jail construction funding. I'm available here to provide any context and to answer any questions that the committee may have regarding any of these augmentation proposals.
Ms. Costa.
Yes, thank you. Again, we don't support the legislative augmentations. In the interest of time, I will just focus on the Prop 47 savings for state hospitals. We have a particular concern with the Senate's version, as we have other proposals later on in the agenda dealing with increased capacity and the needs. And so the savings are concerning to the administration.
Thank you, Ms. Costa. Senator Nielsen.
Well, let's start with finance. You voiced some concerns about these state hospital savings. Now, either you or ledge analyst or both of you, it's been my observation that we're not reaping huge dividends in Prop 47 savings. Now, what savings are we talking about here in terms of any state hospital commitments in the mental hospital? Is that what we're talking about? What Prop 47 savings are we accruing, and are they measurable? Do we know how much?
Teresa Calvert with Department of Finance. The state saving, or the Proposition 47 savings associated with the state hospitals, is based on the cost estimate of patients that are no longer being served by the state hospitals as a result of Proposition 47. And so that was used in the Proposition 47 calculation. But those beds are in high demand as we have an incompetent to stand trial wait list and have other proposals that increase state hospitals' capacity. And so,
what vacated the beds, though? Are those mental health placements that have been didn't get made, and they would stayed into the community? Is that correct?
Correct. So these are patients that were at the state hospitals or on the wait list for these placements that would no longer need a state hospital bed as a result of Proposition 47. But again, we are facing an incompetent to stand trial wait list of over 400 individuals.
And you have people waiting in line.
We have people on the wait list, and so we would.
So you're arguing there's no savings?
There's no savings. It was done for the purposes of the Prop 47 calculation.
Yes, that's one of the issues we need to dig deeply into as we deal with the budget and these purported Prop 47 savings. That's a very important point here for us to dwell on. Thank you.
Thank you, Senator. Member Bloom.
Thank you, Mr. Chair. If I didn't bring this up now, I think I'd be very upset with myself later on today. But in light of the tragedy at UCLA this morning, I'm looking at the $4 million for suicide hotline, and it does appear that, at least at the facts that we know right now, that this tragedy was related to a suicide. And it all of these, with the exception of the Prop 47 savings, somehow deal with childhood and adolescent mental health, and you know, we're in a place where these issues are extremely important for us, and I think we really need to be giving them serious consideration. I'm particularly concerned about the $4 million allocation for suicide hotlines, which appears to be a circumstance where counties are not willing to pay for this. The state thinks the county should be responsible. The counties, because it was Prop 63 money before, think that the state should be paying for it. And we shouldn't end up in a place where we're fighting over this for years and nothing happens and people's lives suffer, or people suffer for it as a result. So I just want to put out there that I think these are important issues, and I know we will be considering them seriously, but I hope that we'll be taking them up and making some changes in the budget.
Thank you. Senator Leno.
Thank you, Mr. Chair. A question for Mr. Johnson. With regard to the Prop 47 savings, and though my good colleague Senator Nielsen and I may have differences of opinion with regard to Prop 47, I think we're going to agree on the point I'm going to pursue here, which is that per Prop 47, any savings, if it's not identified by the initiative to be spent on particular services, whether for victims or for drug treatment or whatever else it may be, is to go back to the general fund. Now, if state hospitals then has a case to make that they still need additional funding because they have a backlog of need for beds, then they come to us and make their case, and we determine whether in fact that need is accurate, and then we decide to fund it or not. But they don't just, it's not appropriate for them just to keep the money and say we're going to spend it for another reason. Or am I off base here?
Senator Leno, Jonathan Peterson with the Legislative Analyst's Office. I can provide some context related to the question you have about the Prop 47 savings. When we discussed this item previously in a report that we published, what our main guiding principle was in determining how we would account for Proposition 47 savings is that first we should identify all of the savings that was generated by the measure and provide and use that amount of savings and then determine the costs related to actually carrying out any additional workload generated by the measure in that previous fiscal year. For DSH in particular, there was just savings generated from Proposition 47. There wasn't a corresponding cost as a result of increased workload generated by the measure. So that's where you get this $8.9 million in savings. And given that, as you mentioned accurately, that the administration proposes to allow DSH to keep this savings generated from Prop 47, that really this reduces legislative oversight over that funding. We certainly acknowledge that there is an IST wait list, as the Department of Finance mentioned. However, that wait list is generated from other factors besides any sort of corresponding workload from Prop 47. So in order to have what we think is a guiding principle of the measure, which was to have no net impact on state expenditures, you would have to reduce the Department of State Hospitals budget to account for the savings in order to pay for the deposit that goes into the Safe Neighborhoods and Schools Fund, which is the fund that you mentioned, where the savings is directed to then go to specific purposes as outlined in Proposition 47. And if there was additional workload that the department had that kind of filled, that they essentially backfilled from this savings, that it would be appropriate for a proposal to come to the legislature so that they have so that you, the legislature, has the opportunity to consider whether it aligns with your priorities or not. And certainly one of the priorities could be the IST wait list, but there could be other priorities as well.
So it really is a question, and your point being, and in your suggestion to the legislature, is one of legislative oversight, that these are not decisions that the executive branch gets to make unilaterally. We get to be a part of that decision making. And the additional workload, as you're pointing out, is completely independent of any savings from Prop 47. That is a workload that does or does not exist. They get to make the case to us. We get to make the case that it's a priority for us and that we're going to fund it, or not because of some other priority. But that's a process we need to be very respectful of.
That is a correct summary of our position on this issue. Right. Correct.
Hate to repeat you, but just wanted to clarify. Thank you.
Thank you. Assemblymember Alberti.
Thank you, Mr. Chair. Several issues ago, Senator Nielsen raised the concern that the governor's jail construction money was being reappropriated. And here again in this issue, we see another case where the Assembly and the Senate budgets both propose to do that for various purposes. And while we can debate the merits of what that money is to be used for, I just wanted to register my concern with the reappropriation of that money. And that's something that I definitely think we need to discuss as we begin our deliberations.
Thank you. Any other questions, comments? Okay, thank you. We'll move on to issue 4, Medi-Cal. Ms. DG.
Office. We're on page 12 of the agenda now with Medi-Cal legislative augmentations. The Medi-Cal budget for 16-17 is roughly $18 billion general fund. The Assembly's budget included 4 augmentations, totaling approximately $64 million general fund, and these are ongoing costs. The augmentations include increasing eligibility for the Aged and Disabled program, restoring the acupuncture optional benefit, providing additional funding for Medi-Cal race and ethnicity data collection, and revising the billing methodology for family planning drugs. The Senate's budget included 1 augmentation that would provide one-time funding to supplement drug dispensing fees at a cost of $1 million general fund, although we note that the $1 million general fund is really a placeholder amount intended to move this item into conference for further discussion. We're happy to answer any questions to provide context.
Thank you. Ms. Costa.
Again, we oppose the legislative augmentations offered in this package. Of note, I would say for the quality assurance fee, we would simply note that we're still in the process of reviewing the managed care regs, which just came out earlier this month. And we would note that this type of a proposal would require federal approval, and that can lengthen the amount of time where you can actually realize the revenues.
Okay, thank you. Senator Nielsen.
To finance the changes with the governor's budget, with changes to ingredient cost and dispensing fee, I understood that those were to somewhat balance each other out, and it would be, I would think, an unintended consequence and unfair that ingredient payment would decrease before the dispensing fee would be increased. Wouldn't that put these, particularly the smaller pharmacies, at a disadvantage? I'm not maybe thinking so much about the large pharmacies, but the smaller pharmacies, this would seem to me to put them at a huge disadvantage. Am I reading that wrong?
Adam Dorsey, Department of Finance. So you're absolutely correct that because of a change in federal regulations, two different changes in federal regulations, that there is a reduction to the payments that will be made to pharmacists for dispensing certain drugs. It is likely a temporary reduction until a study can be done to evaluate the acquisition costs for these drugs, and a new dispensing fee and rate methodology will be in place at that point. But the state was sort of at the mercy of the federal regulations that have been in the works for a very long time, and came down this year. And so we're implementing federal law.
Couldn't you have done a rate survey prior to, rather than to try to undo the problem later?
Yes. The problem that's been faced by the administration is that draft regulations and discussion about these regulations being finalized has been around for so long. There's state statute about these rules that's already in place. We just didn't know when they would be finalized. And to avoid continuing to do studies, year after year, not knowing if we would ever need them, didn't seem like a prudent use of state resources. And now the regs have been finalized, and we're in a position where we have to implement.
And so what do we say to the small pharmacies?
It is a reduction in the amount of money that goes to pharmacists, when we have a new rate study, we'll be reimbursing based on the acquisition costs of those drugs.
But what's lost is lost, correct?
That is correct. If the legislature were to approve an augmentation similar to what the Senate action, I think, envisioned, that it would have to be a perspective. The amount that you could look back in terms of retroactively approving a change in our state plan with the federal government is very limited.
But we could do something prospectively to ease the burden somewhat.
Yes, and I think that is the intent of the Senate action,
yes, okay.
and not part of the governor's budget.
That's where I was headed. Thank you.
Thank you. Any additional questions or comments? Okay. Seeing none, we're moving to issue 4, homeless assistance and poverty reduction. Yes, Senator. Perfect. Thank you very much.
That would be that.
Mr. Woolsey.
Thank you, Mr. Chair. Ryan Woolsey with the Legislative Analyst's Office. Issue 5 includes several augmentations that relate to assistance for low-income individuals and homeless individuals and families. The Assembly provided a total of $18 million in funding above the Governor's May revision for 2 items, including $16 million to establish a diaper assistance program that would provide a $50 voucher for each child under age 3 in the CalWORKS program, specifically for families enrolled in welfare to work and child care. And these vouchers could be used to purchase diapers. Next, a $2.4 million augmentation to lift a once-per-lifetime cap on certain homeless assistance benefits in the CalWORKS program. Under the Assembly action, these benefits would be available once annually. The Assembly also adopted, without funding, some trailer bill language that clarifies language adopted with last year's budget with respect to when the longest recertification period should be assigned for CalFresh recipients. On the Senate side, funding of $97 million was provided above the governor's May revision. That includes $44 million to increase grants in the SSI SSP program by $10 per month. This is in place of the governor's proposed 2.76% cost of living adjustment, as well as $50 million in one-time funds for SSI SSP outreach. The Senate actions also include $2 million to purchase food that would be distributed at food banks in the state through the statewide emergency food assistance program. And we'd be happy to provide additional detail where we can on any of these items.
Thank you. Ms. Costa.
Again, in general, we do not support any of the legislative augmentations in this package. I would note, as the analysts raised, that in the May revision, we did include $36.5 million general fund for a COLA increase to the SSP portion of the grant on a one-time basis starting on January 1st, 2017, using the California Necessities Index of 2.76%.
Thank you. Any comments, questions? Mr. Obnorton.
I had a question for the LAO regarding the diaper assistance proposal. Is that $16 million just for the vouchers, or does that include the cost of administering the program?
It's our understanding that that amount relates to an estimated 26,000 children per month that are currently enrolled in child care and that would qualify. So that cost represents the ongoing annual cost for the vouchers.
So not administration, just the vouchers themselves?
That's our understanding.
So if you had to score the cost of that, would it be higher than $16 million if you rolled those administrative costs in?
It's not clear at this time what the cost would be. The infrastructure is not in place at this point for the vouchers to be provided, and it's not clear how long it would take to put that system in place or what the cost could be. As a result, the budget year costs of implementing the Assembly's action could be significantly different from the $16 million that are included in the action.
All right, thank you.
Assemblymember Gonzalez.
I want to speak to the diapers as well. Obviously, it's near and dear to my heart. It's actually my bill. But one of the reasons we wanted it in the budget is to have some specific conversations about the cost of administrating it, because we're working on year 3 of putting a bill in. This is absolutely necessary. I just want to explain the need for this in case it's not clear. You're a working mom. You finally got subsidized childcare. You've made a great effort to get back on your feet. You're still in CalWorks, of course, but subsidized childcare means you either have a job or you're getting an education or getting training, and you show up and you have to provide 8 to 10 diapers per day to the child care facility. On a stipend that we're now giving on CalWorks, that means close to anywhere, a fifth of your entire stipend is going towards diapers. It can't be purchased with food stamps. It can't be purchased with WIC. So we know that this is a barrier to employment for women trying to get back on their feet if we want people to get off of CalWorks and actually have a job. And somehow we can't seem to get a cost estimate on what this would require the department to implement a program like this. The bill language doesn't mirror this exactly because, of course, we prefer it to line up with the cards once WIC is on the EBT cards, and we think that would work better. But in the meantime, we have a whole host of mothers who have no way to functionally get off CalWorks because every time they start to put something in line, there's another barrier, and this one being a barrier to childcare, which of course is a barrier to a job. How can we work with the administration to actually get a number on what implementation costs would be without throwing quite frankly, $16 million would provide some diapers, would help some women. We'd like to see that in the meantime while we're waiting on those cards, but there's just been no information about what a program like this would cost.